This House is in session.
Announcements by Your Honor, the Speaker.
I am in receipt of a letter from the Honourable Santi J. Or Bashra MP, Deputy Prime Minister and Leader of Government Business. April 14, 2022. His Honour the Speaker, the Honourable the House of Assembly, Parliament Buildings, Trafalgar Street, Bridgetown. Your Honour, the House now stands adjourned until Tuesday, April 26, 2022 at 10 o'clock a.m. Pursuant to Standing Order number 6.9 of the Standing Orders of the Honourable the House of Assembly, I hereby submit that the public interest requires that the House should meet on an earlier day than that to which the House stands adjourned in order to debate a resolution under Section 28, subsection 2 of the Emergency Management Act, Cap 160A, to extend the proclamation which is due to expire on April 22nd, 2022, that a public health emergency exists. Should you be satisfied that the public interest so requires, government requests that the House should be summoned to meet Tuesday, April 19, 2022 at 10 o'clock a.m. Government proposes that the business of the House should be that mentioned above. Yours faithfully, Honourable Santi J. O. Bashra MP, Deputy Prime Minister and Leader of Government Business. I am satisfied that the public interest so requires.
Messages from Her Excellency, the President. Petitions. Papers.
Honourable Member for Christchurch East.
Mr. Speaker, I'm commanded to lay the annual report of the Barbados Prison Service for the financial year ended 2020.
Honourable Leader of Government Business.
I beg to give notice of a resolution that the establishment of the standing committees be referred to the Standing Orders Committee.
Notices of questions, reports from select committees, first readings of bills, statements by ministers, congratulatory and/or obituary speeches, personal explanations, motions for leave of absence, oral replies to questions, notices of motions for the adjournment of the House on matters of urgent public importance, orders of the day.
Honourable Leader of Government Business.
Thank you, Mr. Speaker. I beg to move the suspension of Standing Orders 6, 16, 18, 20, 42, subsection 5, 43, and 44 for the remainder of today's sitting.
Beg to second that, sir.
Questions that the aforementioned standing orders be suspended for the remainder of the day's sitting. All those honourable members in favour, please say aye. Those against, please say no. Meeting the ayes have it. The aforementioned standing orders are hereby suspended for the remainder of the day's sitting.
Government business, sir.
Government business is the order of the day.
Order number 1, sir. In the name of the Honourable Minister of Health and Wellness, to move the passing of a resolution. Order number 1. To move the passing of a resolution to extend the public health emergency in accordance with the Emergency Management Act, Chapter 168.
Honourable Member of St. Michael West Central.
Thank you, Mr. Speaker. The matter before the House is a resolution to extend the state of the emergency, and that extension is intended to go until the until the end of September, the 22nd of September to be exact, Mr. Speaker. Mr. Speaker, as you may know, the proclamation was first issued by Her Excellency the President on March the 23rd of this year and is due to expire on April the 22nd. And in accordance with that, and the ministry having given further thought to what is obtained in Barbados, we believe it necessary to seek this extension until the 22nd of September. That is the state of the emergency, as we continue to manage the affairs of the Ministry of Health and the government in respect of COVID. Mr. Speaker, you may well recall that starting in September, going back to 2020, that the government, based on the COVID situation that they were faced with, had to institute a number of measures. Included was the state of emergency, and that started all the way back in 2020. This is the fifth, I'm told, the fifth state of emergency that we've had to deal with in this country in respect of the management of COVID. And I dare say, Mr. Speaker, that since 2020, the country has come a very long way. I have already given credit to my predecessor minister, the former representative for the city of Bridgetown, who would have spearheaded and led the charge in respect of the management of COVID up until the time where the House was prorogued. And he did, along with his team of officials in the ministry, an outstanding job in bringing us to the point when he demitted office. That work largely helped Barbados to manage the COVID situation. The pandemic at the time, as we know, had global implications and global reach. And as a result of that leadership, we now find ourselves in a position today where we can continue to manage in a very efficient and transparent way how we deal with this COVID pandemic. Mr. Speaker, it would also be remiss of me not to thank the frontline and other healthcare workers who are involved in this fight and have been involved in this fight since 2020. For them, it has been a very long and tiresome journey as they continue to help Barbados to manage this health crisis, as we refer to it. Those efforts must at all times be recognized, because were it not for the courageous men and women on the front line, Barbados could have been not in the position it is today. But thanks to them, we are in a better position because we have minimized the number of deaths. We have helped people who were sick to recover, and we were able, as a government, to put the resources behind our frontline workers and other institutions to ensure that Barbados didn't fall like other countries who, Mr. Speaker, regrettably had difficulties managing their pandemic, where we saw in other places, in other countries, where you had an overburdensome and overwhelming situation and hospitals and frankly, just the ability to get things done with some degree of dignity and measure. We didn't have that here. And we were able, because of the investment made by the government of Barbados, by the effort that the frontline workers put in, that we were able to manage the situation, much to the admiration and respect not only of Barbadians, but certainly to persons who are involved in health matters globally, and also to our and also to member countries who would have seen how we manage this pandemic. Mr. Speaker, we were also able to build out a Harrison's Point facility, which is a critical isolation facility to help us manage it. That is, we separated, as we all know, those functions from our primary health care facility, the Queen Elizabeth Hospital. And that was done in such a way in order for us to help manage the crisis that we were faced with at the time. Mr. Speaker, the Harrison's Point facility, thanks to the visionary leadership of the Prime Minister, the Honourable Member for St. Michael North East, was able to have a facility built in short time. And again, I want to go on the record and thank all of those who were involved in the refurbishment of that facility and getting it well equipped so that it remains a facility that all of us in Barbados can be proud of. It's a dedicated facility, staffed with dedicated men and women who are professionals and who go about their duties in the most admirable way. I had the opportunity to visit the Harrison's Point facility, and it was the first time I had visited. And I must say that when I saw it, the first time I saw it, I said, well, this is a wonderful opportunity. It gave, and it continues to give, the necessary care and generally hospital care and other benefits associated with such a facility to ensure that as many of those who enter the facility, that they be treated and returned to society. So, Mr. Speaker, by way of background, I know some of this would already be known, but it would have been remiss of me not to thank the healthcare workers and all the other frontline workers who did an outstanding job. Mr. Speaker, I would also want to, and I've done so since assuming the role of Minister of Health, to thank Barbadians for their overwhelming support, for their discipline. They too have helped us to get through this healthcare crisis in a manner, Mr. Speaker, that I think all of us shall remain ever proud and faithful. Because were it not for the discipline, were it not for Barbadians following the directives, and were it not for Barbadians following the critical advice of the healthcare professionals, like I said, we could have been in a much more difficult situation. But today, thankfully, and thanks to their continued support and encouragement, notwithstanding that we will have some, issues to manage, and occasionally we will have to ensure that as public health planners and officials advise us, we will have to advise them, because as we are seeing, there are several waves coming through as a result of COVID-19. It is no secret, because last Thursday I would have made the point that CARF samples that were sent off to CARFA, that's the Caribbean Public Health Laboratory in Trinidad, confirmed that another strain of the COVID-19 variant, the BA2, is in Barbados. In fact, as I said then, 90% of the samples that were sent to CARFA confirmed that the BA2 subvariant of COVID. So we never know. Upon a virus will thrive, we will try to do our best to mitigate it. But when we have the different variants emerging, then we have obviously to have some measure of caution and public health guidance. And therefore, what we see today and what we learned last week and months prior, we will have to apply that same approach to ensuring that we do not put our population at risk. Mr. Speaker, it's for that reason that we give guidance and we maintain communication with the country and the people in the country, because we cannot allow all those gains that were made by the ministry and by this government to go contrary to all that we set out to do. And we are not going to reverse those gains. Mr. Speaker, the government, in dealing with the public, continued, obviously, to relax key measures. As members of the House would know, that the curfew was discontinued, and then there were other measures based on the science, and I have to reiterate it, based on the science, that allowed us to make changes. As a matter of fact, Mr. Speaker, because of the relaxation of most of the measures that we had implemented, we're now seeing the return to social and economic life in Barbados, and that is important. Obviously, since, managing in an environment in COVID for the last 2 years is difficult for planners. But when you think about the people, the population, we know it can become very tiresome and very challenging. And therefore, we did what we had to do on the basis of the best public health and scientific data available to ensure that we did a gradual relaxation of the measures. We did so for the sporting community, and we will continue to evaluate because we recognize that mental health is critical, and we have to ensure that we at all times help those persons not only to get back to work, but to have good mental health as well. So in thanking all Barbadians, I felt it necessary to let them know that the Ministry of Health, and certainly this government, will continue to give guidance and advice on the pandemic and how we respond and manage the pandemic. We are aware of the global trends. I just returned to the country yesterday, and I recognize even in the United States that there's one state, well, not more than one, but they're contemplating whether or not they should revert to a mask mandate. We are monitoring what is happening here, and we have to monitor what is happening here. I must say that the government continues to do an excellent job detecting the virus at its borders. I am very pleased with the operations of the Ministry of Health, General Port Health, not only at the airport, but also at our seaports. And we continue to do a very good job in detecting the variant or any positive persons who are coming through our system. We will continue to manage the situation. It is only necessary, it's only obvious, that we have to continue to manage the situation, but at all times, we must be guided by scientific data. And I want to restate that, Mr. Speaker, because when you are dealing in public health, and I didn't know anything about public health before I joined the Ministry of Health and Wellness, but when you're dealing with matters of public health, you have to be very cautious, especially in managing your borders. And I think the government continues to show that we are doing an excellent job in that respect. Even persons who are coming through Barbados, visitors coming through our facilities, compliment us for how we're doing. Yes, there are certain changes that have been asked for. I'm listening. The government continues to listen to those who make representation to us. And at every available opportunity, I reach out and we have meetings. Only last week, we had a meeting with the Barbados Hotel and Tourism Association that went well. I explained what had happened in respect of the current situation, and I said to them that we should regroup and have continued dialogue, and we've agreed to do so within the next 4 weeks. So, Mr. Speaker, even though we continue to relax measures and we continue to manage this pandemic, I want to give the House the assurance that this resolution that is before us, which will extend the state of emergency until September the 22nd, is something that we have to do. We have to do it because we are uncertain what will happen out there. We don't know tomorrow if there'll be a more significant strain out there that could compromise Barbados and its population. So for that, and for that reason, we have to extend the state of emergency until September, when we probably have a better feel of what's happening there. Mr. Speaker, I also think that it's important that I take this opportunity to remind Barbadians that boosting and vaccinations, that those two things are, those two things are critical to us managing in this health crisis. It is important because, overwhelming evidence suggests that persons who are vaccinated and are boosted, that they have a greater chance of survival, and they're not seriously ill to the point where it could compromise them. And I think that we should encourage, and I will use this opportunity to continue to encourage Barbadians to be boosted and to be vaccinated. If you want to seek the guidance of your medical practitioner, then please do that. If you want to engage in other conversations, I suggest you do that. But it is important that Barbadians be boosted and be vaccinated, fully vaccinated, because it is absolutely important. Mr. Speaker, in respect of a second booster, that matter will soon be engaging the discussion of the country, and we will discuss that at the appropriate time and let persons know, because I know that some persons have been asking whether or not they will have an opportunity for a second booster. But the Ministry of Health and Wellness at the appropriate time will make the appropriate message and communication available to the country, and we will speak to it as we have done. But I really want to say that even though, and we've seen it in respect of the vaccines and boosters, BA2, highly transmissible, highly contagious, but the severity of deaths and serious illness, we've not seen that in this particular wave. And that is why I'm really pleading and asking Barbadians, seek the guidance of your medical practitioner, get the best possible advice, do whatever you have to do to research, but I absolutely think it is critical to their continued longevity and risk of serious illness that they consider being vaccinated and boosted. That is for those who have not done so. Mr. Speaker, I know that I have taken a lot of the Chamber's time to discuss this matter, but it's very important, and I consider it to be critical to the economy of Barbados and also to the lives of Barbadians. And therefore, I felt it necessary to be a little bit more expansive this morning. I would use this opportunity as well to encourage Barbadians to continue with all the hand hygiene measures, the sanitization, the washing of hands, continue with all those measures, the wearing of masks, until we are told otherwise, the mask is still perhaps the best defense in us trying to reduce the spread of this COVID variant in Barbados, and therefore I would encourage Barbadians to continue to do so. We have a number of vaccines still available to us, fortunately for Barbados, and again, the leadership of the country, that is in the name of the Prime Minister, the former Minister of Health, and the Chief Medical Officer and the Deputy Chief Medical Officer, and all of those at the ministry and the frontline workers. We ensured that we had more than enough vaccines available to cover Barbadians as well as boosters. And we still have vaccines, and Barbadians are more than capable of going to the various vaccination sites and getting the vaccines and or the boosters as we continue to manage this particular wave of this pandemic. Our home isolation program has worked well, and that complements the isolation facility that we have at the Harrison's Point. We don't have any issues in respect of the discharge certificates. Those matters were put to bed, and we will continue to maintain the home isolation policy and ensure that we manage and work very well with Barbadians. There are a number of stories where persons who weren't vaccinated, weren't boosted, when they took sick, complimented the ministry and particularly the officials at the Harrison's Point, led by the Most Honourable Dr. Corey Ford. Mr. Speaker, I know I didn't give you permission to call his name, but I don't think that you would object to him and his team for the outstanding work that they continue to do at the Harrison's Point facility. Barbadians who've been to that facility, and there are several, have complimented that facility. They've complimented the medical care, they complimented the food, they complimented just the experience where persons were, and Mr. Speaker, if you've never had a chance to visit that site, on official visit, of course, I would encourage you, Mr. Speaker, and I'd be delighted to have you as my guest and to visit that facility just to demonstrate to Barbadians what they have. The facility is well laid out, well staffed, well equipped, and I must tell you, because of my days back in the hospitality sector, there's nothing like that view that you have there, oceanfront view that you can have as you convalesce and you recover from COVID-19. So I really want to thank the Most Honourable Dr. Corey Ford as well and his team, and all health, frontline health workers in Barbados for all that they continue to do. I know that it has been a very tiring 2 years, and you can see that being reflected in the system. But thanks to those frontline workers, we are here today in a much better place as a result of all the work that they have done, the saving of lives, the advice that they would have given in terms of keeping persons in tune with what is happening. And I think that goes a long way in terms of and demonstrates the capacity of Barbados' healthcare facilities. I also want to say, Mr. Speaker, that we will continue with our messaging and our communication. You will note that periodically we don't necessarily have the media briefings, but I will send out a recording to the media houses. And that, once again, is to keep Barbadians up to date, keep them in tune as to what is happening. And I give Barbadians the assurance that whenever this is a government interested in transparency, we campaign on transparency, and as a result of the high levels of transparency that we have displayed, Mr. Speaker, that I commit to Barbadians that we will continue to give them the information. If there are any new trends out there, we'll be out front and advising them and letting them know. I know that sometimes on social media we will hear that, there are several things happening in the community, but at the same time, we can't manage based on social media. We have to manage based on the realities in Barbados, what is happening globally. And fortunately for us, we have organizations like the World Health Organization, and here in Barbados we have PAHO, and they continue to give us guidance and share information with us, and that partnership continues to work very well in the name of all Barbadians. So, Mr. Speaker, I know that I've been speaking for longer than planned, but I thought I would just set the context in respect of the resolution to extend the emergency management order. And Mr. Speaker, on that note, I would like to ask that this matter be. I'm just trying to get on that note, Mr. Speaker, I would like to ask that this resolution be passed. Thank you.
Honourable member for St. Philip North.
Mr. Speaker, my hand was not up to speak as yet.
Sir, she was not indicating to speak.
No, he did not indicate to speak.
Honourable member for Christchurch East.
Mr. Speaker, I guess speaking on this resolution is an appropriate time to clear up some concerns that members of the public may have with respect to our current practices in relation to the COVID directives and certain policies of the government as informed by the Ministry of Health. And one such policy and one such recent amendment to the directive was in relation to the penalties for wearing of masks. Now, I want to clarify something. Prior to the amendment last week, sir, the offense created by not wearing a mask was an offense for which you could be arrested and charged. And when you were charged, you were liable under summary conviction to a fine of up to $50,000. So I'm going to explain what that means in order to explain what has happened since. So if you were found not wearing a mask, where wearing a mask was prescribed action. So if you're in certain public places, on a bus, for example, and you did not wear your mask, and for some reason it was stopped and the police challenged you, as it obtained before last week, for the police to enforce the law, they would have to arrest you, charge you, you go in front of magistrate, and then if the magistrate found you guilty of not wearing your mask without reasonable excuse, you could face a fine of up to $50,000. Nobody got fined $50,000, but the possibility was there that the fine could range from $0 to $50,000. And we know, sir, as lawyers, that within that entire range is a discretion. There's a discretion to reprimand and discharge, which allows the magistrate to enter no conviction against you, but tell you you were doing foolishness and don't do it anymore. There's the next level, which is a conviction, reprimand, and discharge, where the magistrate felt that in the circumstances a conviction should be entered against you to put it on record, but didn't wish to take it any further to either fine you or imprison you. And then there was a sentence, which might include the fine of anywhere from $0 up to the $50,000. And if you don't pay the fine, then you might find yourself incarcerated. So I want to spell that out as what obtained before. Now, consistent with the policy of this government, sir, and the stated policy of the Prime Minister not to criminalize persons unless absolutely necessary, and for us to move to a more civil form of punishment, where you commit an offense, and while, yes, it is on our books as a law, and yes, you have broken the law, we deem that certain offenses don't reach the level of criminality. They don't reach the level where they think that a conviction should be entered against you that might affect you down the line. That it is more like a parking fine, for example, sir, where in many places a ticket is what is given. So you've broken the law, a ticket is given, and if you pay that ticket, then that's the end of that. That's the end of that with no further consequences. And it was deemed, sir, that for a number of offenses, what we would call minor offenses, that are more designed to keep the peace and general protection as opposed to indicative of a criminal mentality and criminal actions on the part of the person who offends, that we should look towards the institution of those civil penalties, those ticketed offenses, paying a fine without registering a conviction. So last week, sir, and why is this important? Because having a conviction means that you have a record. It doesn't matter at what level it is, depending on where you're going to apply for a job, and if you're going to apply for a visa or other things that require a completely clean record, then the fact that you had a criminal conviction for not wearing your mask may operate against you where somebody has a completely clean sheet. So there are consequences, enduring consequences, attaching to somebody who gets a criminal conviction. And for certain offenses, sir, I don't want to say minor because all offenses are serious, otherwise they wouldn't put legislation in place to prohibit the behavior. But for certain offenses, it is deemed that somebody should not suffer that danger of having their record stained in circumstances where it could be avoided, especially, sir, in circumstances where a court more leans towards leniency in that respect than otherwise. So to remove all uncertainty and to remove the possibility of getting a criminal conviction, although the law has not changed. The law still says that if you do not wear your mask, you're liable on summary conviction to fine of $50,000. It has a proviso that where this occurs, the police can issue you with a notice. We call it a ticket, a notice, saying that you have to pay a fine, a fixed fine, so the leeway is removed. You don't have to worry about $50,000 if you toe this line. You pay a fixed fine of $100 within 14 days, presenting yourself to the clerk of the clerk of the magistrate's court for the jurisdiction where the offense occurred. You pay the fine of $100, and that is the end of the matter. It does not affect your record. It does not appear on a certificate of character. That is the end of the matter. So I think a lot of the public did not actually understand that there was the possibility of the threat of a $50,000 fine. And what I'm seeing and what we've been hearing is a lot of people believed that all of a sudden last week the government instituted a fine of $100 for people not wearing a mask. This is not an upscale, sir. This is a serious tone down of what obtained prior to last week. And sir, and the police, I have seen it, I saw it in Oyston, sir, this weekend. The police are not running down looking to charge people. And they're not even running down looking to ticket people. In the vast majority of instances, sir, the police will say to you, if they see you on the street or in a public place or in a bar without the mask on, they will say to you, you need to put on your mask. Usually, it only goes further if you refuse to follow what the police are saying and you're obstinate and belligerent and the police find that there's no other, they can't ignore the offense. You're not heeding the warning, and they feel that in that circumstances, they have to take it a little bit further. Now, the taking it a little bit further includes the option they have to give you the written notice, and it includes the option of paying a $100 fine within the 14 days of the notice. Or if you don't wish to pay the fine and you wish to take your chance in court, you go to court and the law as obtained, obtains. You render yourself liable to a $50,000 fine. And I don't wish to prejudice what may happen in a court, sir, but we all know that if you have a ticketable offense and you refuse to pay the ticket and you end up in court, the penalty of the court is going to be in excess of what was payable under the ticket. Otherwise, it makes no sense. The ticket provides you with the easy option of having your matter dealt with no stain on your record. And the logic, sir, is that without criminalizing you, if you keep getting ticketed, you may eventually do the mathematics and calculate that it's cheaper to wear the mask than to keep paying $100. So the point in all of this, sir, this is an exercise on the part of the government to tone down the penalties and tone down the exposure of the offender in respect of the offense of not wearing a mask. Having said that, sir, the people who have an issue with wearing a mask at all, now, whatever your position on that is, up as of now, it still remains the law in certain circumstances. I once again wish to emphasize the police are not running around out there charging people willy-nilly. Right? If you are on the street by yourself, it is unlikely that you're going to get, so you might get a warning to put it on. But people keep saying, why can I not walk about in the botanical gardens if I'm by myself and nobody near me without a mask? As with most things, sir, common sense is applied in these circumstances. And the majority of these instances where you see people have been charged, it is because a warning was issued and the person refused to heed the warning or refused to obey the directions of the police. I trust I have explained this adequately, that anybody who was confused before as to what now obtains understands, and also that people appreciate that we have not instituted a fine where no fine was before. We've instituted an option that does not result in the criminalization of the offender and significantly reduces the offender's exposure to a manageable amount that they know beforehand. So you know now, if I do not wear my mask where the law prescribes I should wear my mask, I am liable to pay $100. You don't have to guess that it might be $200. You don't have to guess it might be $1,000. You don't have to guess it might be $5,000. It is $100 regardless of how many times you do it. I trust and hope, sir, that that has clarified things for all who were unclear before. And as I'm speaking on the resolution, sir, I entirely support the resolution as well.
Honourable Sir Michael West Central.
Mr. Speaker, thank you. In wrapping up the debate on the resolution, let me thank all honourable members who would have contributed, particularly the honourable member for Christchurch East, who would have clarified several points relating to the whole issue of masking and associated penalties. Let me also give Barbadians the assurance, Mr. Speaker, that the Ministry of Health and Wellness will continue to guide them in managing this COVID situation. It is difficult. We are not out of the woods by any measure, but we have to apply our best scientific knowledge as well as the guidance that we receive from those global partners. There are several other issues that we will address at a later date. Mr. Speaker, I wouldn't get involved in them today, but I know we are listening to the public. We understand their positions, but we also have to be guided, like I said, on the basis of scientific data. At the appropriate time, we will make another intervention and update the country in respect of the measures and the directives that we have to issue in respect of the management of COVID-19. And on that note, Mr. Speaker, I do ask once again that this resolution pass. Do not pass. Thanks.
Better second that, sir.
The question is that this resolution do not stand pass. All those honourable members in favour, please say aye. Those against, please say no. We think the ayes have it. This resolution stands pass.
Yes, Mr. Speaker, as you're aware, this resolution requires a majority, and we are therefore going to ask for a voice vote. Bring it back. Yeah. If Preston comes in.
He was here. Yeah? Come on.
Ready, sir. Ms. Bradshaw,
Aye.
Mr. Marshall,
Aye.
Ms. Husbands,
Aye.
Mr. Ford, Mr. Weir,
Aye.
Mr. Griffith,
Aye.
Mr. Humphrey,
Aye.
Mr. Ford, Mr. Gooding-Edghill,
Aye.
Mr. Abrahams,
Aye.
Ms. McConney, Mr. Ishmael,
Aye.
Dr. Springer,
Aye.
Mr. Lane,
Aye.
Mr. Prescott, Ms. Ford,
Aye.
Mr. Phillips,
Aye.
Mr. Phillips,
Aye.
Mr. Gibbs.
Aye.
Mr. Speaker, online we have Mr. Sutherland, Mr. Sutherland, Your Honor, Mr. Rowe,
Aye.
Mr. Strong, Dr. Brown,
Aye.
Ms. Moore,
Aye.
Mr. Sutherland? Mr. Strawn?
Aye. Aye.
Mr. Speaker, 21 members voted in favor of the resolution, thereby satisfying the threshold of a majority of 60.
Resolution stands passed.
Order number 2, sir. In the name of the Honourable Leader of the House, to move the passing of a resolution that the establishment of the standing committees be referred to the Standing Orders Committee.
Honourable Leader of Government Business.
Thank you, Mr. Speaker. I beg to move that the Standing Orders Committee have this matter referred to it for further consideration.
Question is that the that the establishment be referred to the Standing Order Committee. All those honourable members in favor, please say aye. Those against, please say no. Me think the ayes have it. Honourable Leader of Government Business.
Thank you, Mr. Speaker. I beg to move the suspension of the House until 11:30 a.m. Sorry.
Question is that this honourable chamber be suspended until 11:30. All those honourable members in favor, please say aye. Those against, please say no. Me think the ayes have it. This honourable chamber stands suspended until 11:30.